Well, hello everybody and welcome. I join you today from the land of the Gadigal people of the Eora Nation and acknowledge their continuing connection to land, water and culture. I pay my respects to their elders past, present and emerging, and a very big welcome to all of you here today as well. Our Prime Minister has indicated that the next step after vaccination is the introduction of a COVID passport. The scenario where you have to show your COVID passport before crossing a border, accessing public transport, or even entering public space no longer seems like a scene out of a science fiction movie. So colloquially dubbed the COVID passport, the concept refers to various forms of certificate of the COVID vaccination status, or perhaps even just a negative test status. This technology is controversial. It gives rise to technical, legal, ethical concerns. So today, the Australian Society for Computers and Law is honoured to present a panel of 3 thought leaders at the intersection of law, technology and policy. Each will present a short paper, and you've seen abstracts of those papers in the materials circulated. Following each of the 3 presentations, we'll have an interactive Q&A session. To participate in that, please post your questions in the Q&A function at the bottom of the screen. Dr. Roba Abbas is our first presenter. She'll be presenting on vaccine passports from an ecosystems perspective. Roba is a lecturer and academic program director with the Faculty of Business and Law at the University of Wollongong. Dr. Abbas's current research includes methodological approaches to complex socio-technical systems design and is co-editor of the IEEE Transactions on Technology and Society publication. The next speaker for us today will be Associate Professor Rob Nichols on domestic passport vaccine passports. He's an Associate Professor in Regulation and Governance at the UNSW Business School and a visiting fellow at the UTS Sydney Law School. His research interests focus on competition law, the regulation of networked and platform industries, and an emphasis on the effects of technology and governance. He has a background in electronics and communications engineering, and prior to joining academia, held many leadership roles, including as partner of Gilbert and Tobin and as Australia's independent telecommunications adjudicator. Our third esteemed speaker is the Professor Katina Michael, and she will be presenting on vaccine passports and the growing digital divide. Katina Michael is a professor at the School of Future of Innovation in Society and the School of Computing, Informatics and Decision Systems Engineering at Arizona State University. She's the director of Society Policy Engineering Collective and presently the co-principal investigator of the National Science Foundation Citizen-Centered Smart Cities and Smart Living. Founding editor-in-chief of the IEEE Transactions on Technology and Society publication and is a senior editor of the IEEE Consumer Electronics Magazine. She is a recipient of many distinguished awards, and just one of those is the ICTO Golden Medal for Lifetime Achievement. We are truly honoured to have such a distinguished panel joining us today.
Hello everyone, and thanks very much, Marina. And I'm also on Gadigal land, and I'd like to pay my respects to elders past, present and emerging. I'm going to start with a couple of comments about the Constitution. That might seem a bit odd in a session about vaccine passports, but I think it's really important to get a context about how those passports might be used. As you're all aware, I'm sure, Section 51 of the Constitution sets out those things for which the Commonwealth Parliament can make laws. Importantly, these things are the things that are associated with international borders. So 51(1) provides for trade and commerce with other countries and among the states. 51(27) deals with immigration and emigration. 51(29), importantly, sets that the federal government is responsible for external affairs. Of course, There's also 51.9 that has a single word, quarantine. In the Australian context, health remains a state issue. However, primary physicians, general practitioners, are licensed and organised at the Commonwealth level. We can see some of the effects of this in the rather troubled rollout of vaccination in Australia, where we have states organising mass vaccination centres and the expectation that most people will go to their GP and the GP's practice will receive both vaccine and the associated syringes from the Commonwealth. Okay, now I'm going to turn to stating the bleeding obvious. In the 8 days that seem so far away, especially to me, that we were able to travel overseas, other than to New Zealand, we used a passport. Now, for most people and at most airports, there's an attraction to using the automated arrivals machines. You know, the ones where you put your passport into a slot. If you're like me, take your glasses off, look at a camera in order to be able to pass through an electronically controlled entry gate. This is all very simple. That little symbol that you can see at the bottom of the passport indicates that it's machine readable. So what happens is that there's a radio frequency identification chip in the passport which contains biometric information about your face. Specifically, the face that's in the photograph that's in the passport. Arriving at an international standard which agreed how faces should be coded and how that code should be made available to a passport reading machine was not a difficult task. The major challenge for vaccine passports on an international basis is less to do with a technological challenge and more to do with the information that needs to be recorded. There's a secondary issue, and this issue will become more important, which is what the vaccine passports do, which is separate to any use of a vaccine passport within a country. Essentially, you are probably, if you've been traveling for a long time like me, you end up with a yellow book. Now I've got it on the slide and I'm holding it, and each country is able to accept the validity of a vaccination actually issued in another country. Essentially, the country to which somebody is traveling accepts that the state which certified the vaccination did so in a way which would guarantee that the vaccination was applicable in the visited country. I never had a yellow fever jab. My little international certificate of vaccination provides that if I had, the person administering the vaccine had to sign, say what their professional status was, and state the manufacturer and the batch of the vaccine. I did have a number of other vaccines done, and I got a little stamp for each one. From my perspective, and in the context of today, it seems to me that creating an international vaccine passport is probably a sensible idea. The major challenge will be to consider how to determine which vaccines for COVID-19 should be accepted globally. There's potentially a relatively easy threshold there. It's simply those vaccines that have been accepted by the World Health Organization. That's a challenge for Australia. The range of vaccines that have been authorized by the Therapeutic Goods Administration, or TGA, is limited to those which are in use in Australia. That doesn't mean that other vaccines shouldn't be regarded as comparable in terms of an international vaccine passport. It just adds another layer as to whether and where the vaccine passport should sit. Should it be left in the hands of an authority like the TGA, or should it be left in the hands, as it currently is, of Mike Pezzullo as part of his last actions of Secretary of the Department of Home Affairs before, inevitably, he moves to Defence? Now, there's been no requirement in recent times for vaccine passports to be used at state borders in Australia. I think this is important. It brings out the issue of whether vaccine passports should be used within Australia or only at the Australian borders. Records of vaccinations are kept in the My Health record. If you've agreed to have your My Health record available. Now, I'm disclosing on this slide some sensitive personal information. As you can see, I had the flu vaccine last year and I've had one this year. I've also had the first dose of COVID-19 vaccine. Actually, I'm quite happy to share that I've had my first dose. I'll probably be happy to let people know that once I'm fully vaccinated. However, some of the data associated with the vaccination record reveals information that I'm less happy to share. Specifically, if I was required to provide a vaccine passport to my employer, I would be fine letting the University of New South Wales, a fine institution, know that I'm fully vaccinated. However, I'm merely an academic and my age is 60, letting UNSW know that I received my first dose on the date that's set out in that record also reveals and discloses that I have an underlying health condition. I wouldn't have fitted into any of the other categories on that date. Now, actually, I'm less inclined to share that information. And oddly, if you understand the way that flu vaccines are administered in Australia, you'd also be able to understand from that record that I have this underlying condition from the type of flu vaccine that I received. Now, I think it's worthwhile in the context of vaccination passports to think about the approach that's been taken in the European Union. After all, there are some similarities between a collection of states in a customs and regulation union and the federation that represents Australia. The European Commission has proposed a digital green certificate. What's important here is that the certificate represents a series of compromises, and I'd argue that these compromises are going to be similar to those that will be required by all of the governments in Australia. Now, the EU approach is threefold. First, the certificate needs to be both accessible and secure for all EU citizens. The parallel here is simply that there would be a Commonwealth certificate. The EU Digital Green Certificate has three variants: vaccination, test, and recovery from COVID-19. That's quite likely, basically based on the extent to which Australia has been affected by COVID-19, that vaccination is going to be the major driver here and not a negative test or recovery. Now, the EU certificates are going to be issued in both digital form or on paper. Both of these will have a QR code that contains the necessary key information, as well as a digital signature to make sure the certificate is authentic. Again, it's likely that Australia will need to follow a similar path. in particular, having a certificate that's only available digitally would not provide universal accessibility. The EU certificates will be free, and that also needs to be the case here. There are two very important commitments that the European Commission has made. These are to build a gateway and support member states to develop software that authorities can use to verify all certificate signatures across the EU. And second, that no personal data of the certificate holders passes through that gateway or is retained by the verifying member states. And I think, again, this is going to be an important issue. If there is some expectation that a vaccine passport might be used in any way other than on international borders, the Commonwealth is creating for itself a problem in being able to mirror this European Union approach. Now, the second of the three parts of the EU approach is based on the principle of non-discrimination. The rationale behind the three certificates is to prevent discrimination against people who are not vaccinated. The other element of the principle of non-discrimination is that the digital green certificate is equivalent to a member state proof of vaccination. That is, if a state accepts vaccination to waive certain public health restrictions, such as testing or quarantine, including self-quarantine, they'd be required to accept, under the same conditions, vaccination certificates issued under the green certificate system. It seems to me that this is a reasonable basis for expecting Australian states to have a uniform response. This is not Morrison's exemption from state border lockdown. Instead, it's a mechanism to provide equivalence of outcome. The EU limits its processes to vaccines that have received EU-wide marketing authorisation, but it's clear that member states can decide to accept other vaccines in addition. I think this is going to be the real challenge for Australia. Do we say that the Johnson & Johnson vaccine is equivalent to AstraZeneca? What about China's Sinopharm vaccine? What about Sputnik 5, Russia's first approved vaccine? The third and final part of the EU approach is probably the most critical learning for Australia. The digital green certificate has to contain only essential information and secure personal data. The certificates include a limited set of information: name, date of birth, date of issue, relevant information about the vaccine, and a unique identifier of the certificate. The data can be checked easily, but only to confirm and verify the authenticity and the validity of certificates. I think for an Australian vaccine passport, taking those three learnings from the European Union will take us on a step which says vaccine passports to go to the pub are out, vaccine passports to travel are in. Thank you. I'm looking forward to questions at the end of all of the sessions. And in the meantime, I will hand over to the next speaker.
Thanks so much. So thank you, Marina, Lewis, and the Australian Society for Computers and Law for this opportunity to present. In this talk, I'll build on Rob's excellent presentation and set the scene by providing a framework of thoughts for explaining COVID vaccine passports in Australia, highlighting some of the noteworthy challenges and considerations, and also discussing what we feel will be a helpful theorisation that would allow for measured discussions. My focus will be on the design of COVID vaccine passports embedded within a broader socio-technical ecosystem or ecosystems framework. Katina will then delve deeper into some of the social considerations that I will highlight and introduce with respect to the growing digital divide. So as you may appreciate by way of introduction here, the COVID-19 pandemic has really resulted in accelerated technology design and development initiatives and projects focused in some instances on reactively solving a specific or immediate problem or issue using technological and mobile solutions. And this has resulted from in costs from a financial, socio-ethical, and also regulatory perspective, amongst other implications. For instance, in Australia and globally last year, or during the last year, discussions were centred on contact tracing and tracking technologies and applications that would supplement and aid existing manual tracing processes. Current debates and the purpose of this event today concern COVID vaccine passports in Australia and internationally, including the various types of digital or smart vaccination certificates and passports. And I'd just briefly like to note and point out here that there is a distinction between the term certificate and passport. And the latter is viewed quite as controversial in some respects, particularly from an ethical perspective, a perspective where those vaccinated are being privileged in some way and allowed freedom of movement. Although I would say that the line between the use of the term passports and certificates is often blurred. What then are these proposed mechanisms and what purpose do they serve, I guess, by way of introduction here? So in the initial instance, we are referring to some form of digital medical certificate, e-vaccination or smart vaccination certificate, or perhaps a digital health passport that would verify an individual's vaccination status. According to the World Health Organization, digital or smart vaccination certificates are intended to provide a mechanism whereby individuals can present documentation that really provides proof that they've received their vaccination and that can be cryptographically verified by the required party. As such, there are a number of use cases that are supported. So, for example, the provision of continuity of care is one of these use cases, in addition to your proof of vaccination status. These certificates and passports are advertised as being fundamental in facilitating freedom of movement, permitting border crossing both domestically and internationally, and in some contexts allowing for entry into certain venues and the relaxation of COVID-19 related measures. Some perspectives also regard these passports and certificates as potential reward mechanisms to encourage vaccination and or mass vaccination. So on the following slide, I'd just briefly like to highlight some select international examples that will allow us to appreciate the complexities and considerations associated with digital medical certificates and passports. I'll commence by looking at the WHO's interim guidance for developing a smart vaccination certificate on the left-hand side of your screen. Specifically, the example you see on the slide is release 1 of 3, which is publicly available and was open to consultation recently. So I believe the corresponding consultation process ended in mid-April, and the primary objective of this report is to provide a technical specifications document that will detail responsibilities of member states in relation to technical and other deployment-related factors. So this follows on from an announcement made by the WHO discouraging the vaccine passport route so as not to disadvantage and or isolate countries or certain countries. This initiative is focused on COVID-19 presently with the intention of extending the setup to other contexts in the future. The implementation of smart vaccination certificates as per this initiative can take on a number of forms, such as a smartphone application, for example, cloud-based systems, and a paper-based digital twin type of system. And what I'd like to highlight here is the intention here is to design globally interoperable smart vaccination certificates based on a range of design principles, some of which Katina will speak more to in a moment. These principles relate to equity, accessibility, privacy protection or privacy preserving technologies, and scalability, flexibility, and sustainability. So on this slide, you'll also note a number of other examples, and Rob just mentioned the EU's digital COVID certificate, and the terminology around this particular certificate has morphed from initial discussions. So it started off as a vaccine passport, has progressed to discussions around a green pass, and recently the term certificate has been publicised and spoken of. And this reinforces my earlier point regarding definitions and terminology. Expected to be implemented with corresponding regulation in July, this system will be simultaneously a QR code and paper-based system and will reveal vaccination and testing status. And it's important to note that member states will have decision-making capabilities relating to connecting with other technological solutions. So, for example, contact tracing and tracking programs. And current work is underway with the WHO regarding interoperability with systems beyond Europe. Another initiative that is available on your slide is Common Path, which is a digital health app reporting on vaccination and lab result status, and really relying on a network of participating government agencies, technology and app partners, health partners, in addition to travel industry partners. And there are many examples that we can draw on, but I think the last one, or the last example I'd like to highlight, one that's been hailed a success story, is Denmark's Corona Pass. Regarded as a model or exemplar for European travel, the Corona Pass system has been successfully deployed in Denmark to enable travel and also access to a range of venues and services, and supporting regulation has also been introduced. So I guess the point here is that you might, or you may appreciate that what we seemingly have here is a range of international examples that we can draw on to inform our discussions in Australia, as mentioned by Rob. And this is merely a selection. So we have other examples we can draw on in France's pilot program, and also US-based systems that have been implemented on a state-by-state level. So on the next slide, I'll move swiftly to the Australian context or case. In Australia, as you may be aware, discussions of COVID vaccine passports have been dominant recently. So from talks of the government liaising with major airlines in relation to the passport, to an app for interstate travel, and also to discussions around some interesting dynamics at the state government level with, for example, New South Wales and Queensland voicing concerns over the passport. Additionally, discussions are ongoing with the International Air Transport Association with respect to quarantine-free international travel for Australians that have been vaccinated. I believe that these discussions have centred on the Transport Association's path, in addition to Common Path, which I identified earlier, and Qantas has trialled this particular system. Now, what we've set here is the foundations for our discussions, and I'd like to shift gears and address what all this means in terms of a potential and measured means of engaging with discussions surrounding COVID vaccine passports in the Australian setting, and how we can move forward via a theoretically grounded approach. On the next slide, we can see that to date, and this also applies to the implementation of other technological solutions, namely COVID Safe and other contact tracing and tracking applications that have been deployed globally, the focus has predominantly been on the technological perspective. That is, how we leverage available technology to serve a particular purpose, such as the easing of restrictions, the supporting of freedom of movement, jump-starting economies, and so on. And what we propose here is a shift in perspective to what we feel is a more balanced and measured approach in considering the complete picture and understanding complexity, which we define as the socio-technical ecosystems perspective. And we suggested a similar approach in the context of contact tracing over the past year, and we'll continue this discussion in view of COVID vaccination passports or vaccine passports. So I'll briefly unpack what I mean by this concept. So in terms of the socio-technical ecosystems concept, the socio-technical approach is built on the foundations of open systems theory that some of you might be aware of, and was originally conceived to better understand and design work systems in view of their social and technical components, or subsystems as they're known in the theory. So currently conceptualizations of this theory encompassed an environmental dimension, so we've extended beyond the socio-technical to the environmental dimension. And in summary here, this provides us with a tool through which we're able to model those three subsystems with respect to the COVID vaccine passport. The components within these subsystems are also really important in terms of the interactions, and they provide us with a more accurate picture where vaccine passports and certificates are concerned. Now, moving on to the ecosystems concept, this concept is derived from ecological literature dating to the 1920s and formalized in the 30s to describe the relationship between initially living organisms and the environment. Supplementing the socio-technical notion with ecosystems enables us to understand the socio-technical ecological perspective as per the work of Jeremy Pitt and colleagues. And the emphasis here is on understanding the complex, inextricably linked components within our socio-technical system appreciating the dynamic or the system dynamics, the importance of continuously evolving and striving for what is termed in the literature the notion of equilibrium as related to both the living and non-living elements. So this, we believe, allows for a representative picture and conceptualization of the complexities when we are considering the design and implementation of COVID passports or certification systems. On the next slide, I would like to address what this signifies in terms of moving forward. In view of the considerations and the challenges associated with the proposed COVID vaccine passport concept, so significantly how we conceptualize and theorize the overall system and subsystems within in view of the dynamics and behaviours is really important. And a simple socio-technical mapping exercise, as can be seen on the screen, allows us to shift our focus from the technological or from purely the technological to an ecosystems perspective to appreciate the layers and levels of analysis at the state versus the national and also the international levels, not excluding the individual requirements that will influence this process and that Katina may touch on in a moment. The ecosystems perspective will provide clarity as to the dynamic nature of the system and allow us to better articulate what the purpose of the system is and how we can achieve and also define equilibrium. And this in turn allows us within the context of the social, technical and environmental subsystems and considerations to work towards a methodology that emphasizes engagement, consultation and the operationalization of the socio-technical principles that are introduced here. To conclude on the following slide, I'll provide some of the considerations and challenges relating to each of the subsystems that are evident in media, academic and other reports, to assist us in commencing these discussions from a socio-technical ecosystems perspective. In terms of social considerations, which Katina will delve into in a moment, these include those that are socio-ethical in nature, that relate perhaps to privacy, security and supply related challenges, which in turn result in implications pertaining to equity and access, discrimination, the digital divide, and also the need for stakeholder engagement. In terms of technical subsystem considerations, these really account for the underlying infrastructure, the nature of technological partnerships, technological integration and interoperability, given the patchwork of international measures, certificates and also passports, and even domestically considering how we deal with potential variation between states, and Rob pointed to some ideas in that regard. And finally, just to close, in terms of environmental considerations, those that relate to our corresponding regulatory response and also the appreciation of context. And I think I'll end my discussion here and pass on to Katina to talk through some of these social subsystem considerations. Thank you.
And say a special thanks to my co-presenters, Rob and Roba, who always set me up for a good conclusion. Vaccine passports and the growing digital divide. And I'm going to focus on the word divide today. This is Ed Sheeran's third album, and I want you to just focus on that for a moment with respect to COVID-19. I've looked for antonyms to divide this morning, and they appear on the screen: unite, join, combine, connect, unify, gather, attach, link, couple, converge, multiply. In a time that we're being asked to socially distance and physically distance, this interlocking of hands seems to be a distant memory, but I really want to focus on how we overcome this divide and whether vaccine passports will actually support unifying us and uniting us and reuniting us, allowing us to regather, reconnect, recombine during this very difficult time. A lot of Australians returning to Australia keep telling me, Katina, Australians don't realise the war we've been in overseas. And I say, what war? And it has been actually one of death and destruction because of a global pandemic. And so when I think about the hundreds of millions of people who have suffered at the hands of getting COVID and have had loss in their families, this is what comes to mind. So we often talk technology, but I actually want us to talk people. And that's at the heart of the theory that Robo was talking about. And when I talk about people, if you look at this image, I've turned the divide on its side, and I'm not talking about left and right. This isn't really about politics. This is about us as a community. And At the moment, we can talk about the traditional digital divide. I know when I was going through high school, we learnt about the poverty cycle. The rich get richer, the poor get poorer. And we've been trying to overcome these divisions through the UN Sustainable Development Goals. And we have targets to reach, minimum targets, but many countries haven't reached those targets. If I look at the poverty in the world today, it shouldn't surprise you. Parts of Africa still living in poverty. Note the grey areas are where there is no data, but we have at least statistically made some change. But what kind of access do we have when we are living below the poverty line? It's $1.90 per day of income. When we don't have access to clean drinking water and sanitation. And so 146 countries have met the Millennium Development Goal for water, drinkable water that is, not really clean drinking water, but drinkable. But we can still see so many countries that lack sanitation, and that's where we have a lot of disease and a lot of mortality. So if we look at it now in the modern context, when we talk of digital divide in society, we talk about the digital divide and those who are still stuck in analog world. And this is a division that we have to consider. As a teletraffic engineer in the late 90s to 2000s, I studied these maps and I studied them intimately. I knew where data came in and out, where it was originating and terminating was where countries were actually quite rich and their GDP was significant in comparison to other countries. So fatter pipes from countries that have the ability and very small pipes coming in and out of those that don't. And so how do we bring up these levels for accessibility and equity? But this map that I just showed you doesn't tell the magnitude of the internal story. I can tell you there are people living in poverty in the United States and the infrastructure is decaying all over the place. So we assume that in the traffic intensive nation states, that everyone has a mobile phone and knows how to use it to their advantage. For example, they're not stuck in gambling or gaming addictions, that every internet connection is a broadband connection and stable. I can tell you, having lived in the States for 2 whole years, that actually we have a great internet connectivity here in Australia in comparison. And when people don't know what they don't have, they don't know. There's no comparison. That every internet connection is a broadband connection, we assume this, but I can tell you in places like the Navajo region where people have a very poor narrowband connection and access to even buying something online is difficult, if at all possible. What about Indigenous persons and access to basic services? What about those living with disability, hearing impairment and blindness? That goes back to a lot of the work that Robert Abbas does with the socio-technical design awareness. And what about the homeless or those living with addiction? So we talk about communities of interest in teletraffic engineering, intra-traffic, inter-traffic, long-haul traffic, local traffic, but quite possibly we're talking about social justice issues and environmental issues and energy issues that are quite local, even in developed nations. And this does go back to those who have access to vaccines and those who do not. And it seems quite inequitable to me to be touting a vaccine passport when the majority of the world possibly doesn't have the capacity to even get on a plane, even on a good day, even with everyone in the world being vaccinated, but even worse, what about those that don't have access to vaccines? And so we look at some statistics here from the 15th of March and looking at relative numbers. As of mid-March this year, 380 million doses of COVID-19 vaccines had been administered globally, but around 70 countries had yet to administer a single dose. And of course, that has to do with the speed of creating vaccines, but the accessibility. We see high numbers here in percentage, even in mid-March when it all sort of became available in Israel, for example, in comparison to UK, Chile, low numbers in the US comparatively, the EU and Australia were to be seen. Vaccinated population doses as of mid-May, we had a Nature article published, and again, there's some countries coming up. United States really upping the ante, has caught up somewhat, but still only 20% of its population are vaccinated. Who gets to be vaccinated? How? Where? Why? And we can talk about vaccine passports all we want, but the basic demand here is the access to vaccination in itself. And the truth is, when I asked my local GP here in Australia, when could I get my vaccine? He nodded his head and he said to me, it will be some time. But of course, I have the capability. The truth is, in most nation states, not everyone will be vaccinated because they just can't be. Not because there isn't an availability. They may be lacking the educational awareness. They may be lacking the health access. I know many people in Arizona don't even have vehicles to drive or don't have the capacity to catch a bus. They're infrequent as they are in the burning heat, but how do you get vaccinated if you can't even get to a doctor? So the global vaccine timelines in the globe tell us a lot about the world, and you can see different shades here. I won't go into detail, but look at that, from early 2023. By then there will be herd immunity, say in places like Africa, and we're talking about vaccine passports. Well, why don't we get everyone vaccinated first and then think about the vaccine passports to some degree, although I'm not that skewed in my thinking. I just want to show the inequities here that we have to sort of wake up and think about this. So when we're talking about access, we're talking about those who have access. And if you look at the antonyms of access, it's exclusion. I can either get a passport or I'm excluded. I can get a certificate or I'm excluded. And exclusion means you're locked out. You can't. You haven't got the ability to. And that could be for a variety of reasons. My right to access, here we are. Vaccine pre-orders here on the right through Nature presentation and graphs. We have a global pandemic that we're all going through, and we're still talking intellectual property rights. How dare we? And proprietary science and market monopolies. I am going to name Bill Gates. He has made a lot of money through this vaccine, and it is about patents, and it is about intellectual property rights. Well, you know what? What about, yeah, sure, access to tech so we can overcome the digital divide, but what about access to medicine? And then there's the open science movement argument, where a lot of citizen scientists are starting to say, well, hang on a second, how come not everyone has access? So the world loses under Bill Gates' vaccine colonialism. As many countries wait for COVID vaccines, the world needs a patent-free people's vaccine, not more of Gates' intellectual property stubbornness. So I've just presented to you the social and environmental justice issues that pervade our international context. They always have, but we've got to change this. We have an opportunity to change this. This pandemic is an example of a change that's required. And I don't want to call it a reset, but what about a reset in thinking? Because it's our human right. Everyone has a right to access a vaccine. And I want to use controversial language here. Let's talk about the marked and the unmarked. And why am I using this language is because it started to pop up in the literature. Amazon says vaccinated workers can ditch masks starting next week. And listen to this, fully vaccinated employees will receive a green check mark on screen, which they then can show as proof as they enter their site at the start of their shift. So here we have this division within an organization that is at the forefront. It hires about 650,000 employees annually. And now we're going to be discriminating against people with the check mark and those without. In my own place of work, as Rob earlier alluded to, the potential to upload my vaccine record to the university. I get asked this question every single day, even though I'm a remote worker at the moment, and I'm asked to upload my vaccination record. So the haves and the have-nots, those with the green passes and those with no green passes. Europe moves closer to adopting a COVID vaccine passport. Here's who would qualify. And if we do look at this, as has been presented today, it's actually not a bad example, but listen to this. All individuals who have recovered from the virus, plus those who've tested negative or have been vaccinated, qualify to apply for this fast-track travel authorization. It will not, however, bar or otherwise discriminate against those who have not rolled up their sleeves to get the jab. For the unvaccinated, their right to move within the EU is still intact, but they'd have to adhere to local quarantine orders as they move around. This is not to say that there haven't been inaccurate rapid tests and there haven't been counterfeit negative PCR tests. In fact, the authorities, from friends of mine who have travelled throughout the world in the last 7 days, they say to me the passports and certificates is not what the authorities at different countries are looking for. They're looking for the negative PCR test. We can have everything we want on our phones. They are not interested in electronic showing of anything as proof. They're actually interested in paper. A lot of the US travelers have, to different nations via Qatar and so forth, have had to carry multiple different documentation showing negative PCR tests over time. But who can afford a PCR test of £200, for example, each? And so these are anecdotal stories, but I can tell you they've happened. And different airports want different credentials. It's anyone's guess, what they want. A lot of families are traveling in fear and trepidation over the different documents they have, but they're always told, go and get your things printed. In the case of Arizona State University, faculty who have traveled during this time are constantly asked, what's the Biodesign Institute? And it is actually our own health facility and research institute, but it doesn't seem to be valid everywhere because it doesn't look like a hospital or a medical facility that's assigned the negative PCR test. So a lot of confusion at the moment and a lot of destinations asking for different things. And to top it all off, if we don't only have counterfeits, we've also got people who have been fully vaccinated travelers that have tested positive in Sydney hotels during quarantine. I'm going to repeat that. People who have been fully vaccinated and travelled to Australia have been found to be positive in our own hotel quarantine zones. Kristen Bergatora-Sandvik has been outspoken on the social justice issues to do with problems, solutions and questions, even of the EU digital vaccine passport. In the consciousness of time, I'm going to move on and say that technology continues to change everything, absolutely everything. Well, we knew that when great ships were created, allowing for these routes to take place and for traffic to move around and for goods to be delivered. And this just mimics, of course, airports and airport hubs. And we know there are about 3,200 major airport hubs. And this is the movement of people, not just goods via ship and shipping containers. And if we flip this image, we see a network map and we can start to see the world breathing with these different pieces of hubs and 60,000 routes, all of which have been affected during COVID-19. Now, hang with me for a second, because what if I say to you, one way we can start and propose forward is a map of you and me. It's a map of taking us all over the world and see how we traverse our local areas and our inter areas. Maybe we live within Europe, and then we create digital breadcrumbs, a proposition that has come from many proponents saying, well, we've got the electronics, let's go high fidelity, let's track everything. Let's take visual images, let's look at breadcrumbs on social media, let's connect the disconnected and have one long digital story. It looks a bit like MG Michael's Ubervalence to me, the black box within, that token that we carry that might be embedded or worn. So the requirement to have something other than ourselves, a token or a certificate or a passport. No more events today, but what if that read, you cannot travel today? Well, wouldn't that be interesting? A bit like In Time in 2011, that classic movie with Justin Timberlake, where your time was running out. Well, what if that was a token and your time was actually a message? So mass surveillance or Ubervalence, the who, the where, the what, and all of this has been propagated through the use of QR codes, checking in, checking out, looking at your physical social network and who you actually are with when you actually have dependents with you. It's a bit like we're tagging, tracking and tracing, allowing for this new visibility in the hope of convenience. Yes, you can get back on track. You can go and visit your local pub. You can get on a plane. You can get on a train. But underlying this is the element of control. So is it the misuse and mismatch of technology? I'd say low fidelity tech is really good. We should stick to it. I don't want to risk an ubervalent future or ubervalent technologies of control and oppression that override personal freedom, because in the end, if I'm a person and only a person because I'm carrying a thing, then I don't want to be that person carrying the thing to be a person. And on the flip side, would I rather have no token, a non-person, and be nothing according to some system of governance or government? So I do want us to think about this quite seriously, because what we're seeing is scope creep and function creep, and I'll leave it there to allow you to make your own minds up and go to questions. I'm going to focus on the lack of coordination, the international coordination. Robo showed us some wonderful snaps of different kinds of systems, different databases, different certificates, we have these layers, and the layers of coordination. Where is that international effort? Just like you mentioned, Marina, the UN Sustainable Development Goals, it's a united effort. We can see those goals. I think coordination is lacking, but I'd love to hear what the other speakers had to say.
I think some of that lack of coordination is actually driven by exactly the same issues that you raised, Katina. So if I'm the Secretary General of the World Health Organization, is my focus going to be on vaccine passports for rich people in rich countries, or is it going to be how do I get vaccines available on a universal basis? So in effect, some of the focus that's come from the WHO, I think, reflects the most important thing, which is getting vaccinations out, and in particular, getting vaccines out before more and more variants, which are going to be resistant to the current set of vaccines, are in place. You don't have to worry about the rich countries for that. We're already seeing promises. Well, the next version of Moderna, which will be the one that we have in Australia in Q1 next year, will be able to deal with all of the variants up until about October this year. It's not here we should be worried about, it's elsewhere.
Robo, what's your take on the variance issue?
I might draw back to some of the ideas I spoke about that ecosystem concept. I think we really need to recognize that we're not working, which I think we all have an appreciation for this, we're not working in a static system whereby we can develop these technologies for one particular use case. It's quite the opposite. The idea of an ecosystem has to account for these variants, and we need a system that is scalable to accommodate. Now, back to the SDGs and back to the points that Rob and Katina made, I think at the heart of all of this is consultation, which we didn't speak too much about, but Rob, Katina and I have spoken about this year and in the past, is that the only way that these systems are going to work and accommodate variation, evolution, and the dynamic nature of the socio-technical ecosystem is if we engage in design processes around these systems, these passports, these certificates. And there are some great questions saying we're confusing terminology. I think Stephen mentioned we're confusing terminology here. Are we dealing with a passport? Are we dealing with a certificate? How do we scale this? How do we accommodate emerging, I guess, use cases? And I didn't give a definite answer to your question, Marina, because it's such a complex problem. And what I think we need to do is collectively develop processes for engagement and consultation that will allow us to map out these processes and to gain some kind of clarity around the terminology, so we know what exactly we're dealing with, what the purpose of our system is. Rob spoke about, prioritizing vaccinations in countries beyond, Australia and so on. So is that the purpose of our system? Is our attention to be focused on the certificates or a passport? I think we need to get a better sense of prioritization, acknowledge some of the limitations we have, and consult and engage with people. That's sort of a long-winded answer to your great question.
A 1 minute wrap up from your perspective that you've presented today on what you'd like to see, where is the hope, and how can we help steer in that direction?
I think the hope and focus needs to be based on international issues. For Australia, that is, if we're going to need to have a vaccine passport or a vaccine certificate, it is focused purely on external borders. And more importantly, that the focus is international in terms of support for distribution of vaccines internationally. It's all very well for Greg Hunt to say, well, we've got 80 million doses of vaccine on order. Well, the best will in the world, we're going to need 40 million. Why not start to say now what we're going to be doing with the balance of the 40 million in order to be able to address our neighbours? So perhaps the walk in our neighbourhood that Katina set out should actually think about perhaps the Pacific Islands in our neighbourhood.
And Robo, what would your urgent message be and your reason for hope?
I think my message would be, as it's been sort of since the beginning of the pandemic, is that we require measured approaches and balance to all of these endeavours, particularly where technological solutions are concerned and when we're considering design. So designing from a values-based perspective, from a human-centred perspective, appreciating complexity, ensuring that we discuss quite openly some of the issues that Katina and Rob, spoke about. And consultation is key, as is engagement. And I think sort of the removal of any zero-sum discussions, which we've also spoken about previously, that we shouldn't have to sort of bargain with our privacy and with other things that we hold dear, but rather we should seek balance. We should look at appreciating complexities and also really acknowledge limitations and the dynamic nature of these systems within which we exist, and hopefully go down the route of designing for the people, with the people, rather than on behalf of them. So that's sort of my message. Thanks, Marina.
Thank you, Roba. And Katina, last word to you.
I want to echo what Rob and Roba said and just say this is a human problem, not a technical problem. And we need to get better at utilising the amazing tools that we have at our disposal. But I'm going to say it's not products that are going to solve this, it's processes. And we need to somehow coordinate efforts better and come together, and the solution is local. I actually want to maintain the physical distancing if that's what's required in context of a given nation state, but at the same time not be so distant that I can't communicate with my neighbour about the next steps and instructions. And when I once said this on radio, I was laughed at. What do you mean you want people door knocking to actually raise awareness on education and the importance of vaccination? Well, how else are you going to get the message out there? You know, by telephone, on the TV, in the newspaper, no one cares. So how do we maintain that trust is to get community and community building happening at the local level.
It's a good time for me to say thank you to our panelists. And well, there are some contact details for our wonderful panelists today. Please join with me in thanking them for their presentation. Please join us for future events, and of course, link in and follow our speakers. Thank you all very much for attending, and have a wonderful remainder to the day.